Well, hey, everybody, this is Robert, and welcome to Outbreak News TV. And before we get into the program, just a couple of reminders. If you like the video and like the things that we're doing at Outbreak News TV, subscribe to the channel, like the video, comment below, and share with your friends. Highly appreciated. And let's go ahead and start. What are we going to look at today? Colombia had declared a national emergency for yellow fever. So I'm going to take a quick look at some of the numbers that are going on down there, some of the things that are being done, and just briefly talk about yellow fever just a little bit. So the national government declared a public health emergency due to the active circulation of yellow fever in several regions of the country and the risk of its spread to urban centers. Now, this measure, this declaration seeks to protect the lives of the population, contain the spread of the virus, and mitigate its potential effects on public health. Now, an urgent call to citizens to get vaccinated against yellow fever starting at 9 months of age, including those over 59, is reiterated. Well, between September 2024 and today, 75 cases and 34 fatalities have been confirmed in the country. And this represents a fatality rate of about 45%. So it's really quite large. The cases are distributed in 9 different departments in Colombia, mostly in the south. Right now, the cases have been confirmed in primarily the big daddy of it all is Tolima department with 59 cases. But that's also followed by Putumayo at 7 and several others with 2 or single cases, but 9 departments total. And the deaths, right? A case fatality of about 45%. We have seen fatalities 23 in Tolima department, and 5 in Putumayo, and single digits in 6 other departments. But yes, a very high case fatality with this particular outbreak in Colombia. Now, the outbreak has shown progressive expansion, especially in the areas of the Amazon basin, the Magdalena River, and departments such as Meta in a very short period of time. Furthermore, cases have occurred in territories where they had not been historically reported, such as the municipality of Neira Caldas, located in the coffee growing region. Now, although urban transmission of yellow fever has not been reported in Colombia in about 100 years, 1929, there is a potential risk of reemergence due to the frequent entry of people into enzootic areas where the virus is circulating in its sylvatic cycle through the mosquito species of Haemogagus, and their subsequent displacement to urban areas located below 2,200 meters above sea level, where the urban transmitting species such as Aedes aegypti and Aedes albopictus live. Now, given this scenario, vaccination remains the most effective tool for controlling yellow fever. The analysis of fatal cases has shown that the deceased were not vaccinated, highlighting the urgency of increasing coverage. Now, regional health authorities should prioritize immunizing the entire population over 9 months of age in high-risk municipalities and strengthen the intensification strategy in the rest of the country. Now, within the framework of this declaration of a health emergency, there's been about 10 measures that are being adopted at the national level to contain the outbreak, protect the lives of the population, and ensure a coordinated response from the health system. Three of the primary ones include mass vaccination. So a mass national mobilization beginning in high-risk municipalities and extending nationwide. The vaccine is free, safe, and administered in a single dose 10 days before entering high-risk areas. Now, house-to-house strategies will be established in educational institutions, transportation terminals, military and police facilities, and other public spaces. Also, integrated mosquito vector control is part of the plan. This mosquito control measures will be intensified in homes, communities, healthcare facilities, and high traffic areas, such as market squares and bus stops. Mosquito nets will also be distributed in high risk rural areas. And the third what I consider the big one, is the immediate deployment of basic health teams and immediate response teams. These teams will play a fundamental role in identifying cases, educating the community, epidemiological monitoring, and vaccination, and just bringing the services closer to these vulnerable and hard to reach populations. Yellow fever, let me just talk about that real briefly. Yellow fever is a viral disease that's transmitted by the bite of infected mosquitoes. Early in the disease, like in the first 24 hours, you'll see very generic symptoms like fever, headache, and malaise. But in the following 2 to 3 days afterwards, symptoms often intensify with gastrointestinal symptoms like vomiting, diarrhea, and abdominal pain. Then starting on about the 5th day, signs such as jaundice, which is the yellowing of the skin and eyes, and bleeding may appear, which can lead to death in unvaccinated individuals. It is a highly vaccine preventable disease, and its mortality rate can go up to about 50%. So it's a very preventable disease, and it's also a very potentially fatal disease, one of the more fatal mosquito-borne viruses. Anyway, so that's what's going on in Colombia right now. If you want to keep monitoring this situation, check out outbreaknewstoday.substack.com for all your news about worms and germs, outbreaks, and infectious diseases. And again, my name is Robert, and I'll see you next time on Outbreak News TV.